stricter guidelines for certain counties that are experiencing significantly more transmission in those counties than perhaps in others. Those counties are Attala, Leake, Scott, Jasper, Neshoba, Newton, and Lauderdale counties. We have signed an order in working with Dr. Dobbs and his team that we think will certainly help those individuals in those 7 counties. This particular executive order has several requirements. As examples of some of the most high impact requirements, it requires all businesses to screen employees for sickness. Face coverings should be worn by all employees in businesses where you are not able to socially distance by 6 feet apart from your colleagues. Customers of all retail shops are required to wear face coverings in those counties, and masks are required at outdoor public events like flea markets or live auctions. We have worked very closely with Dr. Dobbs and his team, and as we progress through the rest of this particular press conference, we will be happy to go into more detail. I really believe and I hope that these rules will have an impact, but I also hope that they will serve as a signal to people in these counties. We cannot always see and feel the consequences, but the disease is more active in your county. You need to be even more aware. You need to stay even more sharp. We know that individual action and individual buy-in is more effective than any government order. Please, if you live in those counties, be extra aware of your actions and the risk you face. We have talked about this repeatedly. We believe that the next phase of our fight against COVID-19, and make no mistake, it is a fight. The next phase is to take a surgical approach rather than a sledgehammer to this disease. What we're seeing in certain counties is very different than what we're seeing in those 7. Now, that does not mean that there is no risk to those of you that live in the other 75 counties. We just simply need to pay extra attention to local conditions and respond in that surgical way. In the other 75 counties, I am still urging you to be smart, to stay safe, to recognize that the virus is still in your community. We are going to continue to focus resources on long-term care facilities because we know the devastating impact. We're going to continue to have our shelter-in-place order still in effect for those statewide that are over the age of 65 or that those who have pre-existing conditions. That is the population in our state that is most vulnerable to this terrible, terrible virus. We're going to continue to monitor cases every single day. We're going to continue to make decisions based upon the data, not based upon emotion. So with that, I will ask Dr. Dobbs to give us an update on the virus.
Thank you very much, Governor. A quick update for today. We're reporting 234 new cases today and sadly 22 additional deaths. 7 of those deaths are deaths that happened previously that were identified through death certificates and then validated and added to the list. If we look at where the cases are occurring, we know that they're occurring within specific high incidence counties, and those are going to be specifically in the areas that we just outlined here: Attala, Leake, Scott, Neshoba, Newton, Jasper, and Lauderdale. And if we think about where the action is and where we've been most active in our epidemiology response teams, we break it down into our 9 different teams throughout the state. And in that part of the state, those 7 counties, plus 2 additional ones, we've investigated 2,093 cases. We've done contact investigations and quarantines around that many people. That compares to the Jackson metro area, including surrounding counties, and they've had 1,949. So in those eastern counties, they have a significantly higher burden of disease even than the Jackson metro area, including surrounding counties. So that's something that's very impressive if we think about it. If we look at the testing that's done in the state of Mississippi so far, we are finding additional negatives from smaller private labs. We added an additional 1,600 negatives today that'll be updated soon. And so, although it's not on the website yet, we've documented 97,692 tests. And if we look at the tests that have been done so far, the first 10 days of May, we've done over 26,000 tests in the state of Mississippi. So really a great effort by our partners, and appreciate the hard work that has gone into that. And that's all I have for today, Governor.